Hi everybody, it's Dr. Dave Gustitis here talking to you today about some of the techniques we use with children. When you come into the office with neck pain and you're an adult, it's really easy to describe and explain what you have going on. But for children, it's not always easy to explain why or how the neck pain that they're experiencing came about. One of the things that I find really important to understand and to explain to the parents that come into my office is that there's a study that was done in Germany that was cited in the textbook Manual Medicine that showed that 80% of children, 80% of newborns checked, and they checked 1,000 of them in this study, 80% of them had some level of restriction or fixation, a stuck joint in their upper cervical spine at the atlas, that's the C1 level of the neck. And with that, they found that there was disturbance in sleep, there was disturbance in autonomic nervous system function, which is really the system that helps to regulate the internal organs of the body. So these children, after they were worked on, they found improvement in their overall health, improvement in their sleep. So it's a really powerful area to check, especially in newborns. But children who have never had their spine checked, it's one of the most important areas that we look at. So one of the simple areas, or ways I should say, that we do that is we do a motion study looking at what type of motion is going on in that patient's neck. We also do full spine x-rays to make sure that we know exactly where the areas of misalignments, the blockages are, and the curvatures relative to normal, so that we can help that developing child, that developing spine, the developing body, really to grow in an optimal way. Because if it's growing offline, as it matures, it's going to continue to exaggerate that pattern and actually solidify as an adult. So that can set that child up for a future of even more neck pain. So some kids don't come in complaining of neck pain unless they've maybe fallen off the changing table, they've fallen down the stairs, they've been wrestling with their kid brother, they fell off the trampoline, they fell off the bicycle, the tricycle, they pushed, pulled, grabbed their hair, they played sports, headed the soccer ball, just a couple of ways that kids can have neck pain or have neck related injuries, which is quite a few obviously. But when we look at them, we want to make sure that that pathway from brain to body is clear, and we do a very light and gentle adjustment on them. If you would go ahead and lie down on your back. All I'm going to do is show you really lightly here how we evaluate and what that feels like and looks like. And sometimes I use an instrument called an activator, which gives a very light impulse, a light tap on the vertebra we're trying to adjust. And so it makes a little click sound, but it's a very light touch, and it's no more than that. Easy enough. So if you just tilt your head to the side, I'm just going to help you feel what that is like. Easy enough. Alright, and then go ahead and sit on up for me. And then swing your legs to the side. I just want to reevaluate. I'm looking for that restoration of normal motion. Thank you so much. So if this is something that you're wrestling with, or if you have a child in your life, whether it's a son, if it's a nephew, a niece, a daughter, neighbor's child, or your friend's child, I would really encourage you to bring them in, to have them checked earlier rather than later, because as they're developing, if we can help them to have a healthy spinal pathway, they're certainly going to be healthier overall, and as they're developing, as they're growing, but also it's going to set them up for a future of better health, because that spinal pathway really is an important part of your body because it protects that brain-body connection. So if this is something that you would like to follow up on, please click below and find out more about how we can help you.